And welcome everyone to everyone who attended the first session and also everyone joining us in this second session this morning, where the focus will be on accessing systematic reviews. And yeah, again, a warm welcome to our speakers this morning. And Anel Schoonees is from the Center of Evidence-Based Healthcare at the Faculty of Medicine and Health Sciences at Stellenbosch University. And Anel not only teaches systematic reviews and evidence-based healthcare to undergraduate, postgraduate and healthcare professionals and other decision makers, she's also involved in knowledge translation activities and is well placed to speak to us on this important topic. And I would like to thank Anel and also her colleague for being here with us this morning, Michael. And yes, I'm sure, I think everything is clear in terms of the house rules and the question and answers. So without further delay, over to you, Anel.
Thank you, Ingrid. Just want to check. Pleasure. Can everyone see my screen?
Yeah, we can see.
Good. Good morning, everyone, and especially good morning for those who haven't attended the first session. So like Ingrid said, that this session is going to be about searching for systematic reviews. So in the beginning, I just want to distinguish between people using systematic reviews as a decision maker or a study, or to study, as well as then doing systematic reviews. I believe many of the participants here are postgraduate students who are maybe doing a PhD and doing a systematic review as part of their PhD, or maybe doing a systematic review as a master's dissertation. So when it comes to searching for systematic reviews, it's a little bit more comprehensive than that's what we're going to do today, because the focus today is the introduction, where we're going to search for as if you are going to use the systematic review. Now, for those of you who are going to do a systematic review, this is not, in vain that you attend this, because this is the first sensitization to the comprehensive way of searching for when you actually do a systematic review. So just in the beginning, so that it's clear, so when you actually are going to do a systematic review, the search terms and the mesh terms and things that you're going to use and apply are just going to be more comprehensive, and you're going to search more databases than just the two that we are going to look at today. So again, we're just going to set the scene with a quick introduction to evidence-based healthcare, or a recap for those of you who have attended the first session. Then we're going to look at the general approach to searching, the different steps. Then we're going to build a search strategy. We're going to do a search demonstration in PubMed and Cochrane library. And then there's also going to be a slide just to show some other databases where you find systematic reviews. After this session, you should be able to describe the basics of evidence-based healthcare, identify the approach to searching, build a search strategy yourself, and perform a search for systematic reviews in PubMed and Cochrane library. So just a quick recap. So in all spheres of life, we encounter uncertainty. And in healthcare specifically, where I come from, we use the approach of evidence-based healthcare to address uncertainty. And evidence-based healthcare is really to improve the patient or the population's outcomes. And in order to achieve that, we merge the best evidence, the expertise and the experience of the healthcare worker and the decision maker with the patient or the population's values, cultures, religions, and expectations. And these are the 5 A's, or the 5 steps of how we do or approach evidence-based healthcare. And the first one we've looked at in the first session, which was about asking questions using the PICO approach. And now we're going to look at accessing the literature, in other words, searching for best evidence. Okay. Paul Glasziou is one of the founders of evidence-based healthcare. And a very important quote that he said a while ago was that the search engine is, for doctors, now as essential as the stethoscope. Right? So although it's very important, obviously, that healthcare workers need to be able to attend and care for their patients in a clinical way, it's also very important for them nowadays to be able to search, because searching helps them to stay up to date. So what is our approach to searching? Right? What we learned from the first session was the types of questions and the best study designs that answer that question. So now we're going to apply that, and we use that for searching relevant research. Here on the slide is the steps in finding the best research evidence. So first we're going to know what the type of question is and phrasing your question using the PICO tool. Those two go together. As well as identifying the best study design to search for as number 3. Then from there, we're going to look at what or which of the PICO elements are we going to apply in our search. Because we're going to see that it's not always necessary or useful even to take all the PICO elements and apply that to your search. Maybe then too limited. And number 5 is about identifying the keywords, synonyms, and words with different spelling, so that we don't miss out studies that maybe have used a different spelling for the term that you are looking for. Then we're going to develop the search strategy, also making use of Boolean operators, which are the or, the and the not. Then we're going to select the appropriate databases to search, because it depends on the type of question and the type of studies that you are looking for, what databases you're going to search for or search in. Then we're going to do the search, and then from there we're going to select the most relevant, or in other words, the best research evidence for that type of question. So phrasing our question with PICO. So we're using the same scenarios which we had in session 1, right? I'm just quickly going through it for people who haven't attended session 1. So many people with autism spectrum disorder are very sensitive to touch, including to the face. Imagine that your sister has an 8-year-old boy with autism spectrum disorder, and getting him to wear a face mask is very difficult. Your sister asks you whether wearing a face mask really can result in a large reduction of infection risk, because she wants to know if it's really important for her son to wear that face mask that he's so struggling with. And you tell her you are not sure, you will find out. And your approach to uncertainty is then evidence-based healthcare. So firstly, we phrase the question using the PICO approach. So in other words, in adults or children, within the COVID-19 pandemic, what is the effect of wearing a face mask on the risk of COVID-19 infection compared to not wearing the face mask? That is step 1. Okay, we have identified the question also in the previous session as an intervention question, because the action that's involved here is the putting up of a face mask on the boy's face. And the best study design to search for, you will recall this slide from the previous session, is a summary of what quantitative study designs, whether it's quantitative or qualitative, is the best geared to answer a specific type of question. And we will see in the very top row, it says therapy or prevention question, which is the one that we're using in the scenario, because it's an intervention type of question. And the best primary study design to look for is a randomized controlled trial. However, because we also learned that having various single randomized controlled trials can give you different answers, and then you don't know which one to use. And also because we know it's very important to look at the totality of the body of evidence and not just at single studies, we ideally want to, when we answer our intervention question, we are going to look for a systematic review that answers the question. Okay. Now we're going to look at what is the PICO elements that we're going to search for. Okay. And it totally depends per scenario and question. Okay. The more PICO components that you're going to add to your search, the more you will limit your search. In other words, have fewer search results. Okay. It's important to also search for the specific study design that best answer your question. It's to avoid unnecessary hits. You know, we all have done searches and you come up with thousands of results. And that's obviously not very feasible if you quickly need to get to the answer, right? So we need to spend some time in designing our search strategy, which will pay off when it comes to having to select from the search yield the most relevant study to answer our question. There are some databases where you don't have to search for a specific study design because that database only contains a specific that one type of study design. For example, if you search in the database Epistemonikos, and this database claims that it includes all healthcare-related systematic reviews in the world, you are not going to add a search strategy or a search string for a systematic review because you are only going to find systematic reviews in that database. Okay, we're also going to look at an example when we search the Cochrane library, and I'll refer back to that then. So what components are we going to search for in our COVID-19 and face mask example? So in order to decide that, you need to think of what are the key terms from within this PICO elements that are important to pick up the studies that we are looking for, right? So I identified the I, the intervention, in other words, the face mask, then the outcome or the time point, and why I have the O/the T is because our outcome is reducing the risk of COVID-19 infection, right? So the key that we're taking from there is COVID-19, right? And that is also the key that comes out in the T element of our PICOs, which is the COVID-19 pandemic. So from the outcome and the time point, we're going to use the term COVID-19 as one of our key terms to search for. And then the S stands for study design, which we're going to look for a systematic review, because in the hierarchy of evidence, a systematic review is best to answer a question about the intervention. And when it comes to systematic reviews answering a question about the intervention, ideally that systematic review must have included randomized controlled trials, because a randomized controlled trial is the best quantitative primary study design that answers a question on an intervention. Okay, so ideally the gold standard to find is a systematic review that included randomized controlled trials. So here's a basic table, which we always hand out if we were to do a face-to-face session for people, so that, you know, when they start doing this for the first time, that they plan it first on paper, right? So one can visualize the search strategy better, okay? Some of you might feel that it's not necessary for you, and that's totally fine. But we do find that many students do find this sheet useful when they start to design their search strategy. Okay. Let's go into building our strategy. Okay. So here, as step 5, we are identifying the keywords, right? And in the middle column, you would see I've put the face mask as the I element, the COVID-19 as the outcome or the time element, as well as the systematic review, which is the keyword for the study design, right? But now we must realize that around the world, there's obviously many researchers, and they can use different words, different terms, different spellings to write up their research project, right? So sometimes we're looking for the keyword face mask, but they might have used the term cloth mask in their study, right? So we need to expand our search by looking at or thinking about other terms that speaks to the same thing that we are looking for, right? So I put some ideas in terms of synonyms or search terms for the concept of the intervention. We can also look for a surgical mask, and another name or term, a specific type of surgical mask actually is the N95. Then when it comes to the keyword for the COVID-19, there are various ways that people are writing up their research papers on COVID-19. So I've put a few down for you. And then in terms of the study design, like I referred to in the first session, sometimes people refer to a systematic review as a meta-analysis. And many people use the two terms interchangeably. So even though meta-analysis is not equal to a systematic review in concept, many people use it interchangeably, and sometimes, you know, the title of the paper could be face masks for reducing COVID-19, a meta-analysis, right? And we don't necessarily want to miss out on that particular study. And that's why we're going to use meta-analysis as a search term as well, linked to the study design. Okay. You might note here in the middle column related to the outcome, some of the terms have double quotation marks around, right? That is because that term consists of more than one word. In other words, it's a phrase, right? And the best way in PubMed to search for a phrase is to use double quotation marks around the phrase. Okay. And I'll have a slide about searching tips a little bit later. So this is just some concepts that relates to what we've just spoke about on the previous slide, that we need to think that studies from different places in the world may have used different spelling for the same thing, right? Like the UK spelling for the word randomized uses a S, and the Z is what they use in America. And sometimes some databases pick up these changes automatically. But I will show you now when I do the live demonstration in PubMed that if you take the term randomized with an S, randomized with a Z, you won't get the same amount of hits. So for that specific term, the database doesn't automatically pick up the USA versus the UK spelling. Whereas if you type in the word behavior with a U, it automatically will pick up the same amount of hits for the behavior without the U. But unfortunately, there's no way for you to predict for which terms the database is going to automatically pick up the other type of spelling. So it's always best to use all the different variations of the spelling for the specific term. Okay. So the second point here on the slide speaks to different word combinations, in other words, phrases. And that's what I referred to in the previous slide as well, where we use the double quotation marks in PubMed, for example. In most databases, one would use the double quotation marks, but some databases may not take that. So when you do search a database which is maybe the main database in your field, there will be a section on searching tips in that database, and it will tell you that hyphens gets picked up automatically, or you shouldn't use double quotation marks, or you should for phrases. So each database has more or less a different type of syntax. So if you are from a different field than healthcare, it will be worthwhile to go to your main database that you use most often in your field, and just go and read on the search tips for that database to know which syntax applies to that database. Okay. In many databases, when words are hyphenated, it automatically sees it as a space. Okay. So in the example that I have on the slide, the breastfeeding as 2 words, having the quotes around, should pick up the same number of hits as breastfeeding with a hyphen, right? But as I say, it doesn't always work for all words, and there's no way to predict that. So it's best when you write out your search strategy to spend a little bit more time and write all the different variations of the word out, so you can make sure that it's being picked up if there's research that use that type of spelling. Right. Something else that you might want to consider is lay terms versus the jargon. Right. So mostly in healthcare anyway, people will refer to more the medical term in the article, but you don't want to miss out a study where they perhaps did not use the word hypertension, for example, but only refer to high blood pressure. So it's best to add both in your search strategy. Then also singular versus plural forms. So in our case, for example, face mask versus face masks, right? In PubMed, you can use the asterisk sign, which is the Shift 8 on your keyboard, right? You can use that, or you can write out the different ways, the plural and the singular forms. Again, in some databases, they do not take the asterisk. So again, you need to go read on the searching tips for that specific database, whether the asterisk, for example, applies there. So we've looked under number 5 in the searching steps to the different keywords and synonyms, and those are the building blocks of our search. And then the Boolean operators are the glue that glues the building blocks together to get a search strategy at the end, right? So some of you might be familiar with the Boolean operators and some not. So I'm just quickly going to recap on that. So imagine this dark blue circle represents adults and the light blue circle represents children, right? If we are going to use in our search strategy the Boolean operator and, right, it's going to limit our search to only studies where children and adults have been included in that article, right? So if we say adults and children, it's only going to pick up the studies where both adults and children are included, but it won't pick up studies where it's only about children or only about adults. Okay, so we can see and limit our search. If we use the Boolean operator not, which one should be a little bit careful with, right? It will exclude, in this instance, all the studies that refers only to children, right? Some of the studies refer only to adults, and some of them refers to adults and children, but it won't pick any studies up referring to children on their own. And in that case, you would have searched for adults, not children. Oops. The or is the Boolean operator that broadens our search, right? So if we say adults or children, it will look for all studies regardless of whether they were adults, both adults and children, or children on their own. So we can see that or broadens our search. Okay. Here are some searching tips further. So we spoke about the truncation or the asterisk, which applies to PubMed. The $sign we don't really use in PubMed. But there's an example there under number 1 where it says if you put in the search term learn with an asterisk in PubMed, it will automatically search for learner, learners, and learning, right? Then we get to the wildcard, the question mark, but this one specifically does not apply to PubMed, right? It might apply to your database, so you can go check. And that is where you can put the wildcard to make up for the alternative spelling, USA versus UK spelling, right? Then number 3 is about focusing your search using medical subject headings, okay? I know it says medical and not all of you are from the healthcare field. That's totally fine. In your databases, there will be something similar. It may just be called major subject headings instead of medical subject headings or major words or something like that, right? But again, if you go to your database that you use in your field, you'll be able to read up on that in the information page of your database. The number 4 on the slide is the double quotation marks, right? And that's, as I referred to before, when we search for a specific phrase, it's best to keep that phrase as a whole instead of for the database looking separately at evidence-based and separately at health and separately at care. Okay. So we put the quotation marks around the phrase. And then lastly, in all databases, basically there are limits where you can, at the end, limit your search, especially if you had too many hits. You can limit it by the type of study, although typically we would rather use a search string for the study design, like I will demonstrate to you. You can apply a date limit, or also a language limit if that applies to you. Okay. Now we're going to go over to develop the search strategy. So we've got our search terms, right, for each PICO element that we're going to search for the intervention, the outcome, and the study design, right? And now we're going to add Boolean operators to glue the search terms, the search terms within each PICO element together, right? So we use the Boolean operator OR to widen our search within each PICO element category, okay? So when we go downwards in the table, right, vertically, we use the Boolean operator OR, okay? And within each purple circle, you will see then that forms a search string. So when you apply that in a database, typically you would put brackets around it, right? So we put a bracket, face mask or cloth mask or surgical mask or N95, and then close it with a bracket. That bracket is then referred to as a search string. So we will have a search string for the intervention, a search string for the outcome, as well as a search string for the study design, okay? Then we use the Boolean operator AND to limit our search and to glue all the different search strings together. Okay? So if we go horizontally, then we use the Boolean operator AND. Okay. Just a few words on terminology, if this is maybe new to you. So search terms are the words that we're going to use in our search, right? So if we look at the previous slide, the face mask, so all the words in black in the table are the search terms, right? The search string is where the similar concepts are joined together with the Boolean operators. So the search strings, like I've said, are the things that are within the purple circle, right? And then the search strategy overall is all the search strings joined together with the Boolean operators. Now we get to mesh terms, or in other fields, major subject headings, okay? So why do we have mesh terms, right? It's because you don't always, as the searcher, know all the terms related to the concept that you are looking for, right? So when an article gets published, for example, in Medline PubMed, right, there are people that's working for that database behind the scenes, and they identify keywords for what that article is about. In other words, they tag the articles with keywords. And the concept is similar to you going onto Facebook and tag someone on a photo with you on Facebook, right? And for keywords that get used often, there is a mesh term, okay? So in some countries, people might use different terms for the same concept, and you may not know that. So when you're using mesh terms, you don't have to worry about not knowing all the terms, okay? For example, when I search for an article that is about paracetamol, which is in our country the active ingredient in, for example, Panado, right? And if I use then in my search the mesh term for paracetamol, I will automatically also pick up studies where the researchers use the term acetaminophen. Right? Even though I could have maybe never have heard of this acetaminophen term before, because in America they use that quite widely, but it refers to exactly the same substance as what paracetamol is, and we refer to it as paracetamol. So if I didn't know that and I didn't use the mesh term for paracetamol when I searched, then I would have missed studies that were, say, from America, and they use the term only acetaminophen. They might not even know the term paracetamol, right? So that is why mesh terms are very useful, because it thinks for you where you can't, where your brain can't reach. Okay. And in PubMed, there are 4 types of mesh terms. They are the main headings, the subject headings, publication types, and supplementary concepts. Okay. So the headings, the subheadings, and the publication types, it gets reviewed annually. Then they decide maybe some of them are old-fashioned, or they see, oh, there's many keywords on the same thing. We better add a new subheading, right? And add that to the mesh database, right? The supplementary concepts is how a mesh term starts. So all terms that have are headings, subheadings, and so on, it started as a supplementary concept. They first saw that, okay, there's a lot of articles this year that has been about X, so we create this mesh term for X. And then as the years go on and it gets more researched, then the supplementary concept might move up to be a subheading and maybe even sometime become a heading, right? And that is also specifically related to drugs and chemicals. Okay. We will see later on that COVID-19 now I think it's since May. I will have to check the date, but since kind of recently, COVID-19 has become a supplementary concept in the MESH database, right? And obviously in January this year, it hasn't been, right? So as research evolves, new concept evolves too and gets taken up in the MESH database. Okay. So MESH sounds very good. So why don't we only then search for MESH terms when we do our search? Isn't that then more comprehensive, right? So the first thing is you need to realize there aren't MESH terms for everything, okay? So we will see now that there isn't a MESH term for face mask or cloth mask, okay? There is a MESH term for mask, but that is so general that it's not really what we're looking for, right? So number one, there aren't MESH terms for all concepts, right? Number two is when articles get published, it takes some time for them to be tagged with MESH terms, right? So the articles published most recently, which we might be very interested in, probably might not have been tagged yet with MESH terms. So there's a bit of a time lag. And I've recently actually attended a webinar on PubMed and MESH terms. And one of the questions came up is, what is the average of this time lag? And they couldn't say because it's different fields, different subfields, you know, so it's very important to not only search for MESH terms when you do your search, but to also use normal text words, okay? And then the other thing is, like with most things that where there's human, you know, contribution in, all people can make mistakes at any time, right? So sometimes I have picked it up before that but it obviously doesn't happen often. But sometimes an article is tagged with the wrong MESH term, okay? Or an article is tagged with a MESH term, and it wasn't actually an important concept in that study, right? So it's not 100% foolproof, and it's important then to widen your search with MESH terms, but also with text words. So if we put our search strategy together, it will look like this. This is now before I've applied the MESH terms, okay? And I'll show you in the MESH database when I do the live demonstration how I do find the MESH terms. Right? So here we can see that in the different colors are the different search strings. So the green search string about the face mask is about the intervention element of PICO. The blue one is about the outcome or the time point element of PICO, and the orange one is about the study design element in PICO. Okay. I just want to just say again that we are using here the I, the O, and the S PICO elements to search for, but it totally depends on the question, the specific question, what PICO elements you're going to use. Sometimes it's important to search for the population, right? So say, for example, people with type 2 diabetes, right? Then obviously that will form an important search string, right? The P. And sometimes you will search for a specific intervention and control. In other words, for a specific comparison. So one drug versus another drug. Okay, you're only interested in that. Then you will have a string for the control group as well. Okay. So again, it totally depends on your question, which PICO elements you're going to apply to your search strategy. So now, when you add the MESH terms, those are the ones in green. This is how we then expand our search strategy further. So you will see, as I said, the face mask string, which is on the top, 1.5 lines. There is no MESH term there because there isn't a MESH term in existence speaking to specifically a cloth mask or a face mask for the concept that we are applying it to the scenario, right? There is indeed one for COVID-19, because it's fairly new. It's a supplementary concept MESH term. Then there is a systematic review. The PT stands for publication type. That is one of the other types of MESH terms, right? And the meta-analysis also in PubMed gets listed as a publication type, although strictly speaking, technically, it isn't. It's rather a statistical test. But Michael will speak a little bit more about that and also how to interpret a meta-analysis in session 3 after this session. Now, step 7 is about selecting the appropriate database that you're going to search. Now, like I said in the very beginning of this session, that we are doing this search as if we are looking for a systematic review to use, okay, as a user of a systematic review, not yet as a doer of a systematic review, because that would entail a little bit more in-depth, searching more databases and having a more comprehensive search strategy, okay? But to learn, one first learn how to search in terms of when you use reviews, and that is what we are doing today, okay? So if we are looking for a primary study, if we know, for example, there isn't a systematic review out in the topic, and a good example of that would be, say, we take early March this year, when COVID-19 was not so much research yet, right? There hasn't been a systematic review out yet on COVID-19 specifically, right? So then one would have specifically, in your study design string, look for the best primary study design that answer that specific question, right? And in PubMed, you can find all types of primary studies in healthcare, okay? And there are obviously many other databases as well that includes many different primary studies, okay? Remember, primary studies are things like cohort studies, cross-sectional studies, case control studies, case series, as well as qualitative studies where there's been focus groups done or interviews and so on. Okay. Now, secondly, if you are specifically looking for experimental studies because you have an intervention question, right, then the Cochrane library has a specific database which are called trials, right? And that is a very good database in healthcare to search when you are looking for experimental studies. In other words, randomized controlled trials or other types of trials that are maybe not randomized for some other reason, such maybe ethical considerations, right? So that is one source where you specifically can go and search for experimental studies. Then when we search for systematic reviews in healthcare, PubMed is a very good source, but other good sources are also listed here on the slide. It's a TRIP database. There you can also search for clinical guidelines, which is very useful. Epistemonikos, which I've mentioned a bit earlier, they claim that they include all healthcare-related systematic reviews in the world. And then there's also the health systems evidence database, where they include health system-related topics. Okay. So for the search for this presentation, we're going to look at the PubMed search demonstration as well as a Cochrane library search demonstration. Okay. Just want to check something here. So I'm going to soon go over to my browser. So before I do that, just a quick note on open access. So both PubMed and the Cochrane library from South Africa, when you Google PubMed, and when you Google Cochrane Library, you will find the blue links that are on the slide, right? And those are open access. Anyone in South Africa can access it from any device that's connected to the internet, right? However, but because we are interested in finding a full text article at the end, right, it is best to go via the Stellenbosch University Library, log in via the e-databases and go search PubMed via there or Cochrane Library via there. And the reason for that is just then when you have your search yield and you've selected the article that you specifically want to zoom in on, sometimes the full text link is not automatically there when you go via Google to PubMed, right? So when you are signed into the Stellenbosch University Library into PubMed, then a lot more full text articles will automatically be available just with a click away. Okay. Obviously, you can also, if you don't find the full text link there, you can still go to the e-journals of the Stellenbosch University Library and look at the specific journal and the issue and look for the specific article in that issue. And if you need any more help or direction in terms of how to get that full text, please contact any of your librarians. They will help you with that gladly. So I'm going to move over now to my browser. Can someone just indicate to me whether they can see my screen? Okay, so you can see the university library page. Okay, so on this university library page, I go under Find, I go to eDatabases, I scroll to P for PubMed, and then I'm accessing PubMed. Okay. So PubMed, or all databases, has a simple search, which is this white block here that says Search PubMed that comes up. But I often find it useful on most databases to rather go to the advanced search, right? And I'll show you in a minute why. Okay. So before I start doing the search for the scenario that we've looked at now, I just want to show you why I've said earlier that sometimes the database automatically picks up different spelling and sometimes not. So let's use this example of behavior. I'm just going to say this add to history. So here we can see that behavior brings up, it looks like just short of 4 million if my math is correct here. Okay, so now let's see the word behavior spelled in the American way, in other words, without a U. It picks up automatically the same results. So interchangeably, this database, PubMed, recognizes that behavior has different ways of spelling, and automatically they would correct if you only used one. However, let's look at this example. Say, for example, we were going to look for a randomized controlled trial, and we use the term randomized when we search. Let's look at the number of hits, 1.213 million, right? If we now use the term randomized, but we spell it with a Z in the American way, they've actually corrected that. The previous time that I demonstrated this to people, it picked up much, much less when you search it with an S. So in this way, we also see that databases are continuing, growing and developing and refining their search engine and how it functions, right? But I'm not yet so convinced, because I know just a few months ago, it didn't come out like this, and randomized with an S only brought about 800,000 results, right? So I'm still going to use the different spellings in my strategy, but you are welcome to test this out in your database and apply it as you see fit. Okay, so the reason why, so let me just clean this up so we can have a clean, we can just delete this whole search history in one go. Okay, so let's build our search string, right? So I'm going to start with the intervention string, which we had as face mask, right? So here's our first term, but I want to put the asterisk there to show that face mask can be singular or plural, right? And because face mask consists of two words, I use the double quotation marks. I use the double or the Boolean operator or because I want to widen the search, right? So I'm just going to go on and type all the terms in. I could, of course, also copy and paste, which I usually do, but just for the sake of doing it from scratch for best demonstration, I'm going to do it like this. Okay, so here's our first search string. So I'm going to add that to the history. I'm not bothered about the search results, because at the end, we're going to link all the search strings, right, with an and. Okay. Now, face mask is my first concept, okay? Now I want to look, imagine I haven't said that before. I know I've taught you before there isn't a mesh term that's relevant to our face mask concept. But now let's pretend that this is the first time that we're doing this. And I'm now finding out, I want to find out whether there is a mesh term for this concept of us. Okay. So I'm going to go to the main PubMed page. And there I'm going to see, under Explore, there's the mesh database. Okay. So let's type in face mask. No drop-down comes up automatically. I just want to show you something else. So if if we sometimes when we type in a term, there's an automatic drop-down list that comes that gives you some options. Okay, so here we can see that there isn't an option of face mask, right? There's different types of mask, but we're not interested specifically in a fancy double mask, or that's actually totally something else. It refers to blinding in trials. We're not interested in a gas mask and so forth. So let's just search for the word mask and see. So we can see here with a short description that mask, the mesh term mask, refers to devices that cover the nose and mouth to maintain aseptic conditions, which is what we want, or to administer inhaled anesthetics or other gases, which is not what we want. If we do want to see the breakdown of this mesh term, we can click on the link. And we will see that laryngeal masks will also be under that. Okay, so like I've said with the previous session, when we did the formulating the PICO questions, there isn't 100% right and wrong in terms of the actual wording that you use. So in terms of the searching, there are also different ways. Well, you know, there isn't just one 100% gold standard search strategy, right? So some people may decide, okay, but masks fall under surgical attire, right? Obviously, that's going to be more now healthcare related, you know, within a hospital setting, for example, for healthcare workers to protect them when they work in COVID wards, for example. And that is perhaps not what we are looking for, but it's not necessarily wrong if you do want to apply this mesh term to your search. I do believe it's going to add unnecessary noise for us because we're not specifically interested in masks now for healthcare workers, right, when they work in COVID wards. We're just interested in a mother struggling with a son having to wear a face mask, and she wants to know, is it really good for my son to have this mask on? Is it worth the effort? Okay, so I'm going to decide not to include this mesh term. Okay, so let's go back to our search. Okay, so we click again on advanced search. And what's very nice of PubMed, even if I close this browser now totally, I walk away and I go have lunch and come back, for 8 hours, my search on this computer that I'm now using will stay here, whether I close the browser or even shut down the computer or not. For 8 hours, more or less, my search strategy will stay here in the advanced search. Okay. So we don't have a mesh term for face mask, so then I'm going to move on to the next search strategy, which is about our outcome of interest, which is the COVID-19. Okay. So I'm going to type my terms, COVID-19 or COVID-19 as one word, or SARS-CoV-2 spelled in that way, or SARS-CoV-2 spelled in that way. There are various other variations. I'm just going to add some as example. Obviously, now when you are conducting a systematic review, you will use a much more comprehensive search string for COVID than what I'm using at the moment. While I'm typing, I can maybe just say that for many concepts, let's take COVID-19 as an example, there has been a validated string developed for COVID-19, right? So actually if you Google COVID-19 search filter, you will find the whole search string that has been validated, and we could potentially just copy and paste that whole string. But because it looks a little bit complex for people who's doing this for the first time, I rather just want to keep it simple. So we are typing a few terms in that we know speaks to the coronavirus. What you could also do is you could have one term per box, right? I will use that for the different example, and that is sometimes quite useful if you don't copy and paste like I'm doing now. I'm typing. I can easily make a typing error, and then obviously it may not pick up anything, right? And I might not realize that if I don't put every term in a line that I can see the results in the history on its own, right? So sometimes it's very useful to use only one term per box, and at the end you use or the Boolean operator or to combine them together. Because this is one search box, I don't have to put brackets, but it's also not wrong if I want to put brackets here. So let's add to history. Okay, it shows 45,000 hits. Okay. Let's do now the mesh term for the COVID-19 concept. Okay. So again, I click here on the PubMed.gov. It takes me to the main page. I go to the mesh database. And there I type in COVID-19. Okay. It gives me various options. Okay. See, automatically, it also picks up SARS-CoV-2, which is the name of the virus. Strictly speaking, COVID-19 is the disease, and SARS-CoV-2 is the name of the virus. Right? But these are very biochemical. It might be your field, and these are relevant for you. But for the question in the scenario we're looking for, this COVID-19 supplementary concept is what we're looking for, number 7, right? A viral disorder characterized by high fever, cough, and so forth, right? So how do we go about then selecting this as a mesh term in our advanced search? So you click on the concept, right? You say add to search builder, you wait for it to appear in this white block, and then you simply say search PubMed. Okay, and now if we click on our, we see there's 19,000 hits. Okay, if we click here on the advanced search, we can say it's appearing here under number 3. So now we want to combine line 2 and 3 to make one search string for our COVID-19 concept, right? So we're doing 2, not and, 2 or 3, because we are broadening our search, because we are talking about the same concept. Right. Now let's see here at the results. Whoa. Okay, so by adding, so if we look at the results here, by line number 2, we got 45,836. When I added the mesh term in line 3, it didn't add any new result. So the concepts that I chose here for line 2, which was really haphazard out of the big COVID-19 filter that I know exists on the internet, and that the Cochrane collaboration is using, I'll tell you a bit now about that when I go to the Cochrane library, has actually been quite good, because the mesh term didn't pick up any additional ones. But often this is not going to be the case, right? And your mesh term is going to pick up a lot of additional studies that you haven't thought about. Okay, so here in line 1, we can see our intervention search string. And in line 4 is our outcome search string. Now we're going to move over to our last search string, which is about the study design, right? So systematic review. So I'm going to say I'm going to do this now line for line. Okay. And then I'm going to say meta-analysis. Okay. I've deliberately made a typo there now. And say, for example, I didn't pick that up. It would show me only 6, and I know and that means actually that in 6 articles that are in PubMed, people actually have published it with a typo in it, right? So, but often it will show 0 if you made a typo, right? And that will show you that, oops, something is wrong, so I need to go back to it, right? So let's make the correct one. Okay, now we want to go and see if there's a mesh term for these. Okay, so how do we go about that again? We go to the main page, we click on the mesh database, and we look for systematic review. Okay, publication type. You could also use systematic reviews as topic, just for the sake of time. I'm not going to read through them all now, but I know the publication type one is the one that I want. So how do I get that incorporated in my advanced search again? I click on Add to Search Builder. I wait for it to appear in the box, and then I click Search PubMed. Okay. If I go on Advanced Search, I will see, oh, here it is. Okay. Now I want to see if there's a publication type for meta-analysis too, right? And I know there is, so I can take the shortcut for the sake of time, and I can type it in, meta-analysis, and I can add PT there. If you know the syntax, you can add it. Okay. Okay. So now we want to put together our string for the study design, right? And we can even include this one that's spelled wrongly because it did pick up something, right? If you click on that 6, you will find the actual 6 studies or articles that did make the typo. Okay, but that perhaps is also a relevant study. So let's include them all. So now we're going to say 5 or 6 or 7 or 8 or 9. I like to do it like this because for me it's neater. I'll now show you a different way to do it too, which you might prefer. Makes it a little bit more full. I do it right. 5 or 6 or 7 or 8 or 9. Okay, add to history. So number 10 is our search string. What I also could have done, I could click here and say add. Add with or, add with or, add with or, add with or. See, they are all now lined up here. Like I say, look at all the brackets. It just makes it a bit more busy, but it gives us exactly the same search results than doing it in the coding way, okay, with the numbers. Okay. So now we want to combine our search strings to form our final search strategy. Okay, and the Boolean operator we're going to use for that is AND. Okay, because now we want to limit our search to studies that are about a mask, COVID-19, and a systematic review. Okay, so now we're going to say number 1, and now we need to look for our search term for the COVID-19, which is line 4. And our term for the study design, which is line 10. Okay. 20. Right? That is quite a manageable number of hits. So when we click on there, we see the 20 results, right? So there are many ways that we can display this. Automatically, it displays the best match, but you can choose to see that you want to see the most recent, or you want to have it alphabetically according to the first author or to the journal or whatever. But best match mostly works best according to me. You can also choose how many. We can choose to have all of the hits on the page, and we can also choose to see the abstract and not just the first 2 lines of the background, right? So it just makes it a little bit longer to scroll down, but now we can actually quickly screen through the 20 results and look at the abstract and see which ones most or best match the PICO question that we've asked. Okay. I'll leave that for a little bit later. So say, for example, you've now done your search and now you have a class, or you need to go pick up a child from school or do something else, right? And you don't want this to go away or go to waste, so you can save this, okay? You can use different ways to save this for yourself. I use the citation manager because I use EndNote to manage my references, but you might be using Mendeley, right, which is also good software. So you can send a link for yourself, and then you can open it in Mendeley and in your own time then go through it there, right? You can also decide that you want to search, that you want to save all the results as a text file, where you want the whole abstract included, and then you can download it for yourself as a TXT file. You can always then copy and paste that into Word if you want it in a better font than what the TXT file provides for you. And you can also email the link to yourself, then you can get to the 20 results again when you click on that email link, the link in the email. Okay. Let's have just a quick look on the filters here on the left. Okay, you can decide that you only want to have studies from a certain date. Generally, it won't apply to our question because COVID-19 is only recent, right? But say, for example, you are interested, your question is about a specific new antiretroviral drug for children with HIV, and you know that this drug only has been around, say, for 5 years, right? Then you don't have to search all the years, and you can limit your results by having a filter for publication date. So if we click, it's not going to work now in this example, right? Because I think all the studies are going to have been published in the last year. I think it's going to stay at 20, yes, right? So it's not going to change. But usually when you click on there, it does limit, it does reduce your number of results, okay? You can decide that let's look at the additional filters. You can say, well, let's look at where's the ones about the age, for example, right? You can say, well, I'm not only interested in getting studies on adults, for example, and you will limit there. That is giving us now 0 results. And again, it doesn't really apply now to ours because our question doesn't specifically speak to only a certain age of person, right? So there are some filters that you can play around with, and even if PubMed if you're not in healthcare and you are working with a different database that's in your field, I think for almost all databases would have some sort of filters. Maybe just important to mention that you can in PubMed limit by publication type, and nowadays these filters work better than what it did 10, 15, 20 years ago. It still might be best to use rather your own search strategy like we've done here, to add a search string specifically for the publication type. But often, and we can actually, let's do a check. So let's take face mask, and let's take number 1 and number 4, right? And we add that. I can't type. Okay. Now, say it tells me that no novel. See, I've made a spelling error there. It points out to me that I must actually go and correct it. Okay. So now I want to look at, so now instead of getting, now we didn't apply in line 15, we didn't apply the systematic search string, right? So we got 554 results. So if we click on there, let's see what happens if we go now to the article type and go apply the systematic review or meta-analysis filter. So it went down from 554 to 16, okay? So we got 20 when we used the systematic review search string that we came up with. So it might be that we have missed now 4. I haven't now compared the 16 versus the 20 to see if the 4 that we missed or maybe something that's relevant. But this is just a good example of showing why it's actually a bit better to use your own search string in terms of study design than relying on the filters that they've got here. Okay. Let's go back to my slides. Can you see my PowerPoint slide? I'll take that as a yes. Okay. Okay, I hear that you can't see my PowerPoint slides, so I just need to maybe I must go here on stop sharing and then I'll share again. Is it working now? Yes, thank you. Okay. So on the slides that will be shared with you afterwards on the library page, I just provided like a screenshot of the search in the advanced search box, as well as the search results that we've got. We'll a little bit later can go back to the search results, see, and that is step 9 of our search approach, is to look at which one are we going to identify now that answers our question best. Okay. But before I do that, I just want to show you quickly in the Cochrane library. Because if you are from healthcare, the Cochrane library is a very important source for when you are a postgraduate student and you write your literature review, and also for healthcare workers, and actually for consumers of healthcare, which makes every one of us. You know, there's really very interesting reviews and also shorter clips and posts on the Cochrane library about healthcare questions. Okay. Again, I'm accessing this now via the Stellenbosch University library. So you would see that the highlighted reviews here change over time as new systematic reviews gets published. Okay, maybe I will just give a little bit of a 2-minute introduction about what is Cochrane. Okay. Cochrane is an independent non-profit organization that is registered in the UK, but there are so many collaborators worldwide, over 100,000 collaborators worldwide, that contributes to Cochrane reviews, and also to teaching people to do Cochrane reviews, and also to disseminating the findings of Cochrane reviews. Okay. I'm a Cochrane author, so are most of my colleagues, and you can become too if you are interested. Cochrane also has a training page, and there are many good. For example, let's go on the clinical answers. That is now for consumers like patients or the general public who have questions about healthcare. There are many interesting questions that gets answered here on the clinical answers. For example, does taking vitamin C supplements to prevent the common cold, does it really work? Or does it only work when you have the common cold and it reduces your duration of the common cold when you start taking the vitamin C when you have shown symptoms? Okay, that is just one example. Okay, so at the moment there are over 2,500 different clinical questions, and whatever is your area of interest in healthcare, you can go and browse around here. Okay, but let's go back to the library side. Okay, here you can also see, and on the top are the 2 main databases within the Cochrane library. It's Cochrane Reviews, where you only find Cochrane systematic reviews, and trials, and that's where you find randomized controlled trials or non-randomized clinical trials. In other words, experimental studies on a healthcare question. Okay, you will find them in trials. But if we click here again on the advanced search, and then you go on the search manager. Now, the good thing between PubMed and Cochrane library is that the mesh terms are usually interchangeably. It's not, we will now check, but it's not really going to work for our example now, because face mask doesn't have a mesh term in PubMed and will not have a mesh term in Cochrane library either. And because on the COVID-19 only is a supplementary concept still within the mesh database of PubMed, it hasn't yet been taken up in the Cochrane library as a mesh term. Okay. So this example is not going to work, but mostly all the mesh terms that you have, I would say 99% of all the mesh terms that you have in the PubMed search will also be applied just as is in the Cochrane library search. Okay, so let's start off again with our search strategy. So we have face mask, and again we can apply the same syntax to Cochrane library than what works for for PubMed. The only thing that sometimes doesn't work very well in Cochrane Library is the use of a hyphen, because they automatically see that as a space. Okay, so here's our string for our intervention concept, right? Now we're moving on to the COVID concept, right? So actually what I'm just going to do to save time, I'm going to go back to PubMed. And I'm just going to copy the COVID string that I typed there, because the same applies here. I'm simply going to say search. So also, if you have designed your search strategy in a Word document, you can literally copy all strings over and you can perform a search very, very quickly. Okay, so now we've got our concept of face mask and we've got our COVID-19 concept, okay? Now we'll show you, I've done this yesterday, just to try and see if the supplementary concept comes up. Let's maybe try it without the hyphen. So COVID-19 is not yet a mesh term here. Okay, so now, like I've said before, because the Cochrane Library has two main databases, the one which are only systematic reviews and the other ones which are only trials, we don't have to put in a search string for the study design now. So we're not going to put in systematic review. So line 1 and 2 are our search strings for this database, right? Now we're simply going to combine this with 1 and 2. And then we see these 18 results. If we click on the results, it will show us that there are, of these 18 results, 3 are Cochrane reviews, 2 are protocols. In other words, it's still underway. The people are working on the projects, but it's not completed yet. And if you want to click there, you can actually see which questions are they. It's about feeding strategies for babies, and it's about the diagnosis of COVID infection. Okay, so those 2 reviews are underway. Okay. So here we can see again the 3 reviews. Internet is just a little bit slow at the moment, I say. And because there are so few of them, we can have a look now and see. The first one is about personal protective equipment for highly infectious diseases due to exposure to contaminated body fluids in healthcare staff. Okay, so it's maybe not really the population that we are looking at, because we are looking at general people and not specifically healthcare workers that are exposed to COVID patients in wards, right? So that's not 100% what we're looking for, but it does speak to personal protective equipment. And if we click on this link, we will get the abstract as well as a plain language summary that will tell us what the review was about and what they found. Okay, and we see here this is about signs and symptoms. So this is not about using face masks to prevent. We can also see this is answering a diagnostic question. And here is a nice qualitative example. This review was about barriers and facilitators to health workers' adherence with infection prevention and control. And they did a rapid QES, in other words, a rapid qualitative evidence synthesis. So this might be interesting to many people. Even if it's not your field of study or of work, I think I'm definitely gonna look at that sometime in my own time. It's for the sake of interest. However, I'm opening this link not to go through the content with you, but just showing that the abstract, as well as, which importantly, the plain language summary is displayed here. So even if your grandma has a health-related question and you can find the question or a review in the Cochrane Library, you can point her to the plain language summary, which is a very good feature of a Cochrane review. Okay. Also here, where it says view article information, this link, when the review has been taken up in a guideline, it will also be indicated here which clinical guideline and the link to the guideline. So automatically that will display. Because this is a very new review, it's only published in April 2020, this has not specifically been taken up in a guideline as yet. Okay, right. Let's move back to the slides. And again, here on the left-hand side, you can see there's some filters that you can apply, right? Like the type of question, specific topics, as well as publication date. Okay. Okay. So again, just these screenshots are just for you for recap purposes if you want to go back to it before. Okay. So the last step in our search approach, can you see my slides? Michael, can I just get an indication if you can see my slides? Thank you. Okay, so the last step in the search approach is that we need to select the most relevant. Let me just see, it's not in slideshow view. Let me see. Okay. So now we've done our search, and now we need to select which of the search yields. It was the 20 in PubMed, and then the 3 in the Cochrane library. Which of the search yields is addressing the question that we've been asking? Okay. So these considerations on this slide is just a general guideline. Not specifically necessarily linked to a systematic review, because when it comes to a systematic review, one of the key features that we will look at is when was the last search done, right? Because that is actually how updated the systematic review is. If the search, say for example, we are looking at the systematic review and the search was last updated in 2017 and it's now 2020, then a number of new studies could have come out that also address that question that hasn't been taken up in the systematic review yet. Okay, so ideally we want a systematic review where the search was at least done in the last year or so. Okay, sometimes in a field like COVID-19, maybe like TB and HIV research, for example, many studies come out on a particular question, and systematic reviews needs to get updated more frequently than others. Okay. When I refer to a systematic review being updated is when, say, for example, I've done a systematic review before, and the last search was done in 2017. Now it's 2020, so I take that same systematic review, I conduct a new search from the date 2017 to current, and I see if there isn't maybe any new studies that came out, and if so, I work that studies into my systematic review. Okay. When you haven't searched for a systematic review and you search for a primary study, some of the considerations that you will look at is whether it was multi-centered. For example, if it's a randomized controlled trial, whether there were more than one centers in different settings, maybe in different countries or regions that were conducted. And that's why, for example, the COVID-19 vaccine trials are being done multi-centered, in other words, in different parts of the world, right? Because we don't want a COVID vaccine that only works in certain type of people or certain type of settings, but we want a universal one, okay? And even if we do get some vaccines that work in certain type of people or certain type of settings, then we need to know that, that this vaccine works in this type of setting or this type of people, but not in those, right? So multi-centered trials are very important. And then also, obviously, the number of participants. This might not be so important for qualitative research, but for quantitative research, you would like to see a sample size calculation and the justification of choosing a specific sample size in a specific quantitative study. Okay. Then some general considerations. You would look at the country, the setting, and the context, and whether those of the participants in the study were similar to your patient or to your population that you want to apply the findings to. And then also, in sometimes funding or sponsorship of studies are very important. specifically when it comes to maybe drug, medicine-related or drug-related questions, vaccines, for example, industry is involved, and sometimes it's obviously better to have studies that's not only funded by one company, but by a variety of funding sources, right? That we can be sure that the funding source don't or haven't in some way influenced the findings. Okay. But very importantly, I gave some general considerations here, but if we remember about the 5 A's of evidence-based healthcare, where the first A is asking questions, the second A is accessing the literature, which we're doing in this presentation, and then the third one is critical appraisal of that study, right? And critical appraisal of a research study, whether it's a systematic review, randomized controlled trial, cross-sectional study, or even a qualitative study, right? Is a whole lot of a different, I don't say a different field, but there's lots to it, right? It's a whole different approach, and we can have a webinar of 4 hours just on critical appraisal of a systematic review, okay? But in the next session, my colleague is going to briefly touch on it and refer to how to read a systematic review, which will also be touching on the critical appraisal of a systematic review. But just so that you know here that when you select the most relevant study, you actually shouldn't only looking at these considerations and a few more, but you should look at how well that study has been conducted. Okay, I don't want to say too much now because Michael is going to address it in the next session, but maybe for you who can't attend the next session, just that often us all, when we get to a research study, we quickly read the conclusion, right? Or the results and the conclusion to see what did they find, because we are under the impression, that's the main thing. But actually, the first thing, or one of the first things in the research article that you should look at is the objective. In other words, what did they set out to measure? And then the methods, whether what they applied and how they conducted their study. In other words, the methodology of the study in the methods section, whether that actually is in line with the objectives and when that has been done well. Because if that has not been done that great, then how can you then go on and trust the findings of the systematic review or the findings of the qualitative study or the findings of the randomized controlled trial or of the cross-sectional study? Okay, so it's important when you select the most relevant research evidence to answer your question that you also do screen through the objective and the method section of that study, that you get an idea of was this actually a good study, right? And there are approaches to critical appraisal. If you just quickly, if you Google critical appraisal sheets of randomized controlled trials, critical appraisal sheets of systematic reviews of qualitative studies, you will find free guidelines in table format that will guide you in terms of how to critical appraise a specific type of study design. Okay. Spoken about that. Okay. So just quickly, I think there's just a few minutes left. I just want to go back to my PubMed screen again. I'm just checking, can you see my PubMed screen? Thank you, Michael. Okay, so when we go to our 20 results, and remember previously I've put this, I set this that it shows the abstract as well, and not only the title and the authors and the citation. So from screening through these 20, you will see that because this is also displayed as best match, actually the first one, and I did screen quickly through all of them yesterday, and the best one for me answering this question is the first one, right, by Derek Chu et al., right, in the Lancet. So if you read the abstract, you will see that they did look for a variety of studies because they did recognize that there might not be so many RCTs addressing this question, right? And their search identified 172 observational studies across 16 countries and 6 continents. So that's quite a good evidence base, although they do say here that they found no randomized controlled trials. They also looked at comparative studies. So in other words, this is a good example for when ideally we would have liked to have a systematic review of randomized controlled trials. Sometimes it's not practical to always have that gold standard study design for that question, right? In this case, it's purely because of the pandemic that we're in, you know? COVID-19 is a very recent condition, and most studies are observational because of the rapidness of it. We are merely observe what people are anyway doing. Okay, so that is also very valuable, and we have to go now with the best available evidence, which is not randomized controlled trials, but a lot of observational studies, right? So, and you would see here that face mask use could result in a large reduction in risk infection. And for this specific exposure, I'm calling it an exposure now because they merely observed people wearing face masks compared to those who choose to not do that. Because in some countries, I'm not sure. In our country, it's mandatory to do that. In other countries, it might not be. I'm not 100% sure. So the exposure here was face mask, wearing it, and the outcome was exactly the outcome that we were looking for, the risk of COVID infection. And here we can see that the number of people in this particular systematic review with 2,647. The adjusted odds ratio was 0.15 with a confidence interval, and also the low certainty of evidence. So this is a teaser for you to attend Michael's session that's coming up next, because he will show you what does this actually mean? How do you interpret this result? And what does low certainty mean? Okay. They also looked in this systematic review at N95 mask and so forth. So if you're more interested to go and read on the study, I've put a screenshot of this article. I'm not sure if you can see my screen now again, my slides. But here's a screenshot. Let me just present from current slide. So here's the front of the Lancet article. So if you put this in Google, you should also be getting to this article. Okay. Just quickly on other databases. There are lots of other databases, obviously, also that contain systematic reviews. I've just showed you the two that is two of the most prominent ones in healthcare, but you might be from a different field. And there will also be systematic reviews in most other fields, I think. Like I said, Epistemonikos, strip database, health systems evidence, all contains health-related systematic reviews. Academic Search Premier via EBSCOhost also contains systematic reviews. So does CINAHL. Africa-wide information, I've checked. They contain a bunch of systematic reviews. Web of Science do too. Scopus might be the database that you use more often. There are lots of systematic reviews in too. And then something I want to point out is the Campbell library, right? So Campbell is referred to colloquially as a sister collaboration of Cochrane. Because they focuses more on the social science. Well, they don't focus on health like Cochrane does. Campbell focus on social sciences. So if you are maybe from the field of education, justice, other fields of social sciences, please feel free and go onto the Campbell library and see maybe that is your database of choice for searching for good quality systematic reviews. Okay. I think this might be my last slide, but I think it's very important. When you do a systematic review, if you are a postgraduate student or a researcher or a healthcare professional wanting to do a systematic review, please just note that in the field of systematic reviews, you should identify a gap for a systematic review first. When I learned about systematic reviews back in 2009, there weren't that many systematic reviews out there yet, okay? Between 2009 and 2020, I can't say how many times it tripled or whatever, but there is now so many systematic reviews, and we don't want to duplicate efforts, okay? So it's important to, when you think of a systematic review question, that you identify the gap in your evidence base, in your field, okay? So in healthcare, we've got a database called Prospero, and that is a place where you go and register your protocol before you carry out your systematic review. And in Prospero, you can search to see what are the systematic reviews in health that are already underway, so that you don't go now and do exactly a systematic review on the same question that someone else is spending funds and time to do, right? So just also to say that Prospero takes registrations, and those are free. You can for free register your protocol on Prospero. They do take registrations for systematic reviews, rapid reviews, and umbrella reviews, but not for scoping reviews or literature reviews. Okay. And this is just a summary of the 9 steps that we went through as a recap. For the sake of time, I'm not going to read through them now. And this is just a reminder of what we've learned in the session. We described the basics of evidence-based healthcare, or we recapped it quickly in the beginning, the principles and the steps. Then we identified the 9-step approach to searching. Then we went about and built our search strategy and also performed the search for systematic reviews in PubMed and the Cochrane library. Here are some suggestions for resources. Again, the Akubeng series of Principles of Evidence-Based Healthcare or Medicine is a very good series. There's also specific in the series, there's also an article on systematic reviews, which is very useful. Then the library training. The Cochrane Library has a training hub with lots of videos and resources in terms of conducting systematic reviews. There's the link for that. And again, Stellenbosch University's Faculty of Medicine and Health Sciences has a very good library guide with lots of resources there on the same page. Go and have a look at that. And then if you do want to find out about or learn about or think about Boolean operators again, you have to recap that. There's an entertaining YouTube video of about 7 minutes. I think that link is also on the LibGuides of the Faculty of Medicine and Health Sciences. Go and have a look at the YouTube video on Boolean operators. From my side then, thank you very much. I think our time is up, so I don't think there's much time for questions. I'll give it over to Ingrid to decide if we should take a few questions or not, for the sake of time.
Thank you, Anel. And I think maybe we can, if people do have questions, they can maybe, email us, and we can see, they can send me an email. And if we cannot help them, then, we can also, forward them to you, and hopefully if you can then assist, but otherwise we should be able to also help them. And I can also I'll just put in my email address there, and they're welcome to send an email if they do have specific questions on, the search strategy, especially, and your, the search tips and that type of thing that, you shared with them, if that is okay. So if it's okay with you, I think I'll just wrap up from here. And thank you, Anel, for your very informative and practical sessions this morning on the different types of questions and the practical format of phrasing questions using PICO formulation to help address questions, and for sharing how to apply this and all the other searching tips and the live search demonstrations for searching for systematic reviews. Your passion and your enthusiasm for systematic reviews and research is clear, and I trust our attendees have been inspired this morning to use the practical knowledge you shared in their current and future research. And it will surely save them time and effort, and also result in a well-rounded, well-thought-through search string and evidence-based search. So a huge thank you again. And
thank you very much also to you and all the other organizers and the people working behind the scenes to make this Library Research Week possible. Thank you.
Thank you to you, and thank you for those kind words, Anel. And yes, other than that, we'd like to thank all of our attendees for taking the time in attending this session. And from the library side, we as librarians, we also look forward to collaborate with you as researchers on searching for systematic reviews, either before you conduct your systematic review or when you conduct a systematic review. And for those of you who will be joining us in the last presentation this morning, we look forward to you joining us soon. And if you cannot make it, the sessions are recorded and will be available and also uploaded on the library YouTube channel for on-demand watching and sharing with others afterwards. So we hope to see you in the next session where Michael McCall will then present on interpreting the results. Okay, so bye for now.
Thank you. Bye.
Bye.